Hi, my name is Dr. Dorfman, and I'm going to demonstrate something very simple but often mistreated is how to properly cut a toenail without causing any infections or any problems with the toenail. So we'll begin with typical anatomy of a foot, 10 toes obviously. What happens is this is called a nail plate, and the nail plate lays on a nail bed, and these are the nail grooves on the side, and the nail root lies back here behind the skin. So typically what will happen is a nail will grow from the root out, and that process takes about 12 months. Sometimes it can take up to 18 months. What will happen is sometimes when the nail is injured, it'll take longer, and the nail can get an infection behind the root and develop a fungal infection, or actually become impaired and start to develop cracking and splitting within the nail. The nail grooves on the side here typically will become infected if the nail incurvates or turns inward and into the skin. So sometimes if the nail gets too long, or if the nail gets too sharp and pointy, it'll dig or push into the very corner of the skin. And since shoes are filled with bacteria, the bacterium can get up underneath there and kind of inject itself underneath the skin and get entrapped, and then an abscess will develop and an infection can ensue. So what we want to do when we cut a nail is basically we're looking to cut the nail straight across, and then we're looking to file the edges. We usually advise people not to cut down into the corners, because the more you go into the corners, the more risk there is of developing an infection. The other problem is that some pedicurists find pushing objects like this, and they try to push the cuticle back there. Again, we advise against that, because pushing back there can interject some fungus back behind the root and can really infect the nail pretty badly. So what we'll do is we'll show you how to just cut it straight across and then file it, and we can do that for all the nails. We'll demonstrate with the large toenail. So typically these type of nail nippers, they're called, are much easier to use than the typical squeezing plier type. And what we would suggest doing is starting at the edge and cutting straight across. Just at the skin line and not below the skin line. So what we've done is created a nice straight line, and then what we can do is just take an emery board and just go ahead and file straight across the nail. And that's really all that's needed. Anything more aggressive usually leads to pulling and prodding and picking, and that can cause an infection. Now in our office, from a medical point of view, we have instrumentations like curettes, which I wouldn't advise using at home, and the curettes can sometimes pull out some of the debris that develops inside these nail grooves. And those things can be pulled out. They should be pulled out, not pushed in. And sometimes you'll find pedicurists that will actually push at it, and that can lead to, again, an infection. So gently cleaning out the nail grooves is definitely advisable, and that's something we can do here at the office. And that's a pretty simple way of cutting a nail.